Welcome, everyone. Thank you for joining us this afternoon. This is the Hemophilia Council of California's Advocacy and Public Policy webinar, Choose Smart. Don't be overwhelmed by your healthcare choices.
Those that are in the meeting today, you want to jot down the CaliforniaChronicCare.org website and the MyPatient Rights, and also Covered California has a website. They're really good places to go. Because there's a lot of information I've kind of used like a fire hose to give you today. And I wanted to make sure I got through most of it at the beginning so I could answer any questions people have. But there, everybody should know that purchasing health insurance is complicated. There are many organizations that have been created really to help people choose the right health plan. Everyone wants everyone to stay as healthy as possible, including the health insurers, because remember, you're a lot cheaper if you're healthy for a health insurer. And so it's really a matter of taking a fairly complicated system because we all have very individual needs and making sure that the system works for you. So I'm going to stop there. I can talk a little bit more about some of the work we've done to get people the care they need if there's interest in that. But Lynn, is it okay if we take some questions if you have any?
Absolutely. So I go ahead and feel free to unmute and ask your question. And while we wait for that, I'll say the resource that we showed at the beginning with the checklist is on the MyPatient Rights page. So you can find that there. And that really, like we were saying, applies to folks regardless of whether or not they're looking, say, at like covered California plans and trying to navigate those, or whether their employer maybe has, options for them. I know, like, for example, our family, my husband works for the state of California, right? And so we get our insurance through that, and he has options every year, and we have to know like open enrollment's usually in the fall, and we have to kind of know when those dates are, and we get to look at those options. So people should definitely be aware that like open enrollment could be at different times depending on whether they get their insurance.
So Lynn, I was just going to say, you bring up a really good point that I neglected earlier, which is those of us who have employer sponsored healthcare, brokers, the insurance broker or whoever is the individual that your company works with, is an amazing source for helping you choose the right plan. And I'll use my own personal experience for this because I have a story that I'll share. In that I'm an employer and I provide employer-sponsored healthcare to my employees. I figure I do a lot of healthcare. I need to do that. And so Cindy Settles, who I really wanted to join us today, is our broker, and she is amazing in that she not only helps us choose the right plans as employees, but she also will run interference. And a lot of people don't know this, that when you have insurance, don't forget that you can work with your employer or the broker in this case to run interference, because just 2 weeks ago, my adult daughter, who takes a medicine that she's been taking for 5 years, it's always cost her a $25 copay, went to the pharmacy and they said that'll be $465. And she went, I haven't changed insurance. I haven't changed anything. Well, it's no longer covered. You have to take the generic. And she said, no, I've tried that before. My doctor says I need the brand name. And so she was obviously frustrated. She didn't pay it. She came back to the office and I said that this is what the broker does. So in working with the broker, we found out it's really interesting because her health insurer said, oh, it's not us. The pharmacy said, they're saying you have a $5,000 deductible, which he doesn't. So it was coded incorrectly. And it is a pharmacy benefit management issue that we're now working with the doctor to see if she can get the brand name medicine like she always had. But what's interesting is we didn't change anything. There might have been a deal between a PBM and the manufacturer on the backside. But I will tell you, way too many people will just say, oh, and pay that. And you need to feel comfortable advocating for yourself and saying, wait, time out. What's changed that last month it was $25 and now it's, $465. And that's, I'm an educated consumer and I was dumbfounded until working through it. So,
or worse, they will say, oh, and not take the medication at all.
Well, that's what you did.
Or take the generic that doesn't work.
Right.
So, I mean, that's why these kinds of things are so important. So we do have a question in the chat. It's kind of related question on long-term care insurance, which I know is a little bit different than what we're talking about with health insurance. They ask if it's worth getting long-term care insurance.
That's a really good question. California decades ago did an amazing program that I bought into it for affordable, and then I think it fell apart. And wearing a different hat for the last 4 years, we helped create and convince the governor to create the master plan for aging, which on a project that we worked on called We Stand with Seniors, because the current system with the number of seniors needing care is unsustainable, and we need long-term care insurance and more programs and more supports. So the answer is long-term care insurance is always worth it if you can afford it. And that's the biggest challenge right now, is it's expensive, because if you think of all the costs associated with it. So if you're in a position where you can afford it, and it's quality long-term care insurance, which people need to check on. That's another point I didn't mention earlier, is sometimes we find people being sold like some kind of a random insurance plan that's worth nothing. It's almost like just a copay card for insurance. You need to really look and investigate and make sure it's a reputable company with solid reviews, and check with Covered California and Department of Aging, and HICAP. Again, I mentioned them earlier. It's the health insurance counseling program that focuses on Medicare. They can really guide people in choosing long-term care insurance. If that answers your question.
Yeah, no, that's awesome. So we're a little tiny bit over time.
Oops.
We didn't get too much of a chance to talk about MyPatient Rights, but I do want to just let people know that the resources that we're talking about today in terms of insurance is on this MyPatient Rights website, which Cassie and her team have worked with the Chronic Care Coalition on for a while. And this is great, like, the experience that Cassie just relayed with, about her daughter, and showing up at the pharmacy and all of a sudden you have this huge copay. Well, that's the type of issues that MyPatient Rights is there to address. And so there's great tips and tools there for you should, once you have your insurance in place, if you run into a problem like that, there are great resources on that website to help you navigate how to fix that problem, and then also how to report it in the MyPatient Right website, because sharing that information with an organization like the Chronic Care Coalition, calling us at the Hemophilia Council and saying, hey, I'm having this problem, really helps us to be able to let the partners know at the state and at other organizations about the problems that people are having, so that we can seek to address those at a system level and at a policy level to fix those across the board. And when you're willing to share your story there, which you guys know that we talk about all the time at the Hemophilia Council, right? The power of sharing our stories, and why we've been able to accomplish so much in the bleeding disorders community is because people have been willing to share their stories and take those to their legislators and their public officials. So it's a great resource for all of you. And this is really the first in a series of webinars that we're doing about navigating care in our bleeding disorders. Next month, we're going to be talking a little bit more about managed care. So those types of plans, and we have a doctor and a patient from Kaiser that are going to be with us to talk about how they really were able to form a relationship that helped that family to really navigate the managed care Kaiser world and really still be successful in managing their bleeding disorder. And then in September, we're going to talk about CCS. In October, we're going to talk about patients' rights from the perspective, not so much from the insurance battles, but focusing on just navigating your rights through the healthcare system as a patient. And then, as I mentioned earlier, we're going to talk about Medicare in November. So, please spread the word to those folks that you think would benefit from those upcoming webinars. And as always, they will be also recorded and shared on our website for those that want to access them after the fact. So We thank Cassie again for joining us for this great information. We will put the links on our website along with the video when we have it completed. And we really appreciate everyone joining us today. Thanks so much. Well, we will see you next month.
Thank you, Lynn.
Thanks. Bye-bye.